Okay, when I am thinking about why UCI Urology, I am thinking about a complex urological problem that is happening to a patient. The patient is coming in to see one of our urologists, and that patient need care from different type of subspecialties in urology, in addition to possible care coming from departments outside urology departments, such as colorectal surgery, pain management, PM&R, oncology department, surgical oncology, gyn oncology. So all of these different type of complex urological problems, such as a patient who needs very complex reconstructive surgery after radiation or cancer treatment surgeries, these type of patients are only possible to be taken care of in a place that does have these collaborative multidisciplinary care established. And UCI Urology does have that. We do have patients that come in with a reconstructive need for their urinary tract to put the tube back together and make a functional urinary tract for them. And in addition, they do have a stone. We do have the best of the best in the stone care in our department. And they do have some history of cancer. We do have best of the best in cancer care in urology in our department. We do also have a very highly talented and expert reconstructive urologist in this department. We do have, if the patient is a female, we do have female urology care as needed. If that patient does have sexual dysfunction, we do have sexual dysfunction care in our department. As you see, we do have all different cores that can address different urological problem for this complex patient. And at the same time, we have good connections to these other departments that I mentioned outside urology department in UCI that we can communicate with, connect the patient, and if we need to do a collaborative surgery for a patient, we can communicate and make this surgery happen. This is not something that can be done in every urological institution all around the country, and it does need this complex communication and multidisciplinary care available. The other reason that I would say why UCI Urology is because people in our department in these different subspecialties that I mentioned, they do have cutting edge, tip of the arrow research related to their subspecialty done in their labs or in clinical trials, in clinical studies. This gives the opportunity to the urologist in each of these subspecialties at UCI Urology to know the cutting edge information about the clinical problem they're dealing with. They know what are the challenges, they know what are the things that we don't have in this age and era in that urological problem, and they do know what is the most updated and best practice we do have in this age and era. On top of that, they can be creative, they can offer options that may not have been offered before, and they may be under clinical trials to the patients. So this is something that you can only get in a department with research capacities such as UCI Urology and a multidisciplinary care within the department. Lastly, I want to bring up something that I'm very proud of in our department. We do have a spectacular patient education opportunities. We do have a staff that our doctors have trained that are in close communication with our doctors, and when a complex urological care is required for a patient, our staff can communicate closely with the patient, answering their questions, letting them know about side effects, risk, benefits of that surgery, and let them know if they're having any question that needs to be answered right before the surgery or even after that complex surgery. There is a lot of time that patients would need multiple times of discussion and consultation about the surgery. We do have that opportunity for the patients. They can learn about their procedure before, and they can learn about how to overcome the side effects of a surgery after that procedure. This is something that can only be done in an academic, state-of-the-art institution like UCI Urology.